Proper rest and sleep are as important to health as good nutrition and adequate exercise. Physical and emotional health depends on the ability to fulfill these basic human needs. Individuals need different amounts of sleep and rest. Without proper amounts, the ability to concentrate, make judgments, and participate in daily activities decreases, and irritability increases. Identifying and treating patients' sleep pattern disturbances are important goals. To help patients, you need to understand the nature of sleep, the factors influencing it, and the patient's sleep habits. Sleep provides healing and restoration. Some patients have pre-existing sleep disturbances. Other patients develop sleep problems as a result of an illness or hospitalization. People experience cyclical rhythms as part of their everyday lives. The most familiar rhythm is the 24-hour day-night cycle known as the circadian rhythm. The suprachiasmatic nucleus nerve cells in the hypothalamus control the rhythm of sleep-wake cycle and coordinate this cycle with other circadian rhythms. Circadian rhythms influence the pattern of major biological and behavioral functions. The predictable changing of body temperature, heart rate, blood pressure, hormone secretion, sensory acuity, and mood depend on the maintenance of a 24-hour circadian cycle. All persons have biological clocks that synchronize with their sleep cycles. This explains why some people fall asleep at 8 p.m. while others go to bed at midnight or early in the morning. Different people also function best at different times of the day. Failure to maintain an individual's usual sleep-wake cycle negatively influences the patient's overall health. Sleep is associated with changes in the peripheral, nervous, endocrine, cardiovascular, respiratory, and muscular systems. Specific physiological responses and patterns of brain activity identify each sequence. Instruments such as the EEG or the electroencephalogram, which measures electrical activity of the cerebral cortex, the EMG or the electromyogram, which measures muscle tone, and the EOG, which is the electrooculogram, which measures eye movements, provide information about some structural physiological aspects of sleep. Major sleep center in the body is the hypothalamus. It secretes hypocretins that promote wakefulness and rapid eye movement, sleep. Prostaglandin, tryptophan, and growth factors also control sleep. Research believes that the ascending reticular activating system, or the RAS, located in the upper brainstem, contains special cells that maintain alertness and wakefulness. The RAS receives visual, auditory, pain, and tactile sensory stimuli. Activity from the cerebral cortex also stimulates the RAS. Arousal, wakefulness, and maintenance of consciousness result from neurons in the RAS releasing catecholamines such as norepinephrine. The homeostatic process, which primarily regulates the length and depth of sleep, and the circadian rhythms, which influence the internal organization of sleep, timing and duration of sleep-wake cycles, operate at the same time to regulate sleep and wakefulness. Time of wake-up is defined as the intersection of process S and process C. The normal sleep pattern for an adult begins with a pre-sleep period during which the person is aware only of a gradually developing sleepiness. This period lasts from 10 to 30 minutes. However, a person has difficulty falling asleep, it will last an hour or more. Once asleep, the person usually passes through 4 or 5 complete sleep cycles per night, each consisting of 4 stages of non-rapid eye movement, which is non-REM sleep, and a period of rapid eye movement, which is REM sleep. A person usually reaches REM in about 90 minutes into the sleep cycle. 75 to 80% of sleep time is spent in non-REM. With each successive cycle, stages 3 and 4 shorten and the period of REM lengthens. REM sleep lasts up to 60 minutes during the last sleep cycle. Not all people progress consistently through the stages of sleep. Sleep becomes more fragmented with aging, and a person spends more time in lighter stages. Non-REM sleep contributes to body tissue restoration. During sleep, the heart rate falls to 60 beats a minute or less, which benefits cardiac function. Other biological functions decrease during sleep are respirations, blood pressure, and muscle tone. The body needs to sleep to routinely store biological processes. During deep, slow wave sleep, which is non-REM stage 4 sleep, the body releases human growth hormone for the repair and renewal of epithelial and specialized cells such as brain cells. Protein synthesis and cell division for renewal of tissues such as the skin, bone marrow, gastric mucosa, or brain occur during rest and sleep. Non-REM sleep is especially important in children who experience more stage 4 sleep. Another theory about the purpose of sleep is that the body conserves energy during sleep. The skeletal muscles relax progressively in the absence of muscular contraction, preserves chemical energy for cellular processes. Lowering of the basal metabolic rate further conserves body energy supply. REM sleep is necessary for brain tissue restoration and appears to be important for cognitive restoration and memory. Loss of REM sleep leads to feelings of confusion and suspicion. Although dreams occur during both non-REM and REM sleep, the dreams of REM sleep are more vivid and elaborate, and some believe that they are functionally important to learning, memory processing, and adaptation to stress. The ability to describe a dream and interpret its significance sometimes helps resolve personal concerns or fears. Another theory suggests that dreams erase certain fantasies or nonsensical memories. Respiratory disease, such as COPD, asthma, allergies, or the common cold, often interferes with sleep. Connections between heart disease, sleep, and sleep disorders exist. Sleep-related breathing disorders are linked to an increased incidence of nocturnal angina or angina, increased heart rate, electrocardiogram changes, high blood pressure, and risk of heart diseases and stroke. Nocturia disrupts the sleep cycle. Restless leg syndrome, or RLS, can occur before sleep onset. RLS symptoms include recurrent rhythmical movements of the feet and legs. Patients feel an itching sensation deep in the muscles. Relief comes only from moving the legs, which prevents relaxation and subsequent sleep. Sleep disorders are conditions that, if untreated, generally cause disturbed nighttime sleep that results in one of three problems: insomnia, abnormal movements or sensations during sleep or when awakening at night, or excessive daytime sleepiness. Many adults in the United States have significant sleep problems from inadequacies in either the quantity or quality of their nighttime sleep and experience hypersomnolence on a daily basis. The American Academy of Sleep Medicine developed an international classification of sleep disorders, which classifies sleep disorders in 8 major categories. Individuals with sleep-related breathing disorders have changes in respirations during sleep. Hypersomnias are sleep disturbances that result in daytime sleepiness and are not caused by disturbed sleep alterations in circadian rhythms. The circadian rhythm sleep disorders are caused by misalignment between the timing of sleep and individual desires or the societal norm. The parasomnias are undesirable behaviors that occur during sleep. Sleep and wake disturbances are associated with many medical and psychiatric sleep disorders, including psychiatric, neurological, or other medical disorders. In sleep-related movement disorders, the person experiences simple stereotyped movements that disturb sleep. The category of isolated symptoms, apparently normal variants, and unresolved issues include sleep-related symptoms that fall between normal and abnormal sleep. The other sleep disorders category contains sleep problems that do not fit into the other categories. A polysomnogram involves the use of an EEG, an EMG, and an EOG to monitor stages of sleep and wakefulness during nighttime sleep. The Multiple Sleep Latency Test, or the MSLT, provides objective information about sleepiness and selected aspects of sleep structure by measuring eye movements, muscle tone changes, and brain electrical activity at least 4 napping opportunities spread throughout the day. Insomnia, the most common sleep disorder, is a symptom that patients experience when they chronically have difficulty falling asleep. Sleep apnea is a disorder characterized by lack of airflow through the nose and mouth for periods of 10 seconds or longer during sleep. 3 types of sleep apnea are known: central, obstructive, and mixed. The most common form is obstructive. Obstructive sleep apnea, which are the 2 major risk factors for sleep apnea, are obesity and hypertension. OSA, occurs when muscles or structures of the oral cavity or throat relax during sleep. The upper airway becomes partially or completely blocked, diminishing nasal airflow, which is called a hypopnea, or stopping it, which is called an apnea, and this can last for as long as 30 seconds. Excessive daytime sleepiness is the most common complaint. Feelings of sleepiness are usually most intense on awakening, right before going to sleep, and about 12 hours after the mid-sleep period. This causes a serious decline in arterial oxygen saturation levels. Central sleep apnea, or CSA, involves dysfunction in the respiratory control center of the brain. The impulse to breathe fails temporarily and nasal airflow and chest wall movement cease. The oxygen saturation of the blood falls. The condition is common in patients with brainstem injury, muscular dystrophy, and encephalitis. Less than 10% of sleep apnea is predominantly central in origin. People with CSA tend to awaken during sleep and therefore complain of insomnia and excessive daytime sleepiness. Mild and intermittent snoring is also present. Treatment includes therapy for underlying cardiac or respiratory complications and emotional problems that occur as a result of the symptoms of this disorder. Narcolepsy is a dysfunction of mechanisms that regulate the sleep and waking states. During the day, a person suddenly feels an overwhelming wave of sleepiness and falls asleep. REM sleep occurs within 15 minutes of falling asleep. Cataplexy, or sudden muscle weakness during intense emotions such as anger, sadness, or laughter, occurs at any time during the day. Sleep paralysis is another symptom. Sleep deprivation is a problem many patients experience as a result of dysomnia. Causes include fever, difficulty breathing, pain, emotional stress, medications, and disturbances in the healthcare setting. Owing to long work schedules and rotations, healthcare providers are prone to sleep deprivation. Hospitalization makes patients more prone to sleep deprivation caused by environmental noises and interruptions for care. Parasomnias are sleep problems that are more common in children. These include sleepwalking, night terrors, nightmares, bedwetting, body rocking, and tooth grinding. When adults have these problems, it often indicates more serious disorders. Rest does not imply inactivity. When rested, people experience feelings of rejuvenation, feeling refreshed, and able to carry out activities of daily living. Illness and unfamiliar healthcare routines affect the usual rest and sleep patterns of hospitalized patients. It will be important to allow patients periods of rest. Nurses frequently care for patients who are on bed rest to reduce physical and psychological demands on the body in a variety of healthcare settings. However, these people do not necessarily feel rested. Still, some have emotional worries that prevent complete relaxation. You must always be aware of a patient's need for rest. Lack of rest for long periods causes illness or worsening of existing illnesses. Sleep duration and quality will differ across the lifespan. In adolescents, shortened sleep time often results in excessive daytime sleepiness, which frequently leads to reduced performance in school, vulnerability to accidents, behavior and mood problems, and increased use of alcohol. Pregnancy increases the need for sleep and rest. However, a majority of pregnant women describe variations in sleep habits. Estrogen has been shown to decrease REM sleep. In middle age, the amount of stage 4 sleep begins to fall, a decline that continues with advancing age. Older adults experience weakening, desynchronized circadian rhythms that alter the sleep-wake cycle. Episodes of REM sleep tend to shorten. There is a progressive decrease in stages 3 and 4 non-REM sleep. Some older adults have almost no stage 4 or deep sleep. A number of factors affect the quality and quantity of sleep. Often several factors contribute to a sleep disorder. Physiological, psychological, and environmental factors inhibit sleep. Sleepiness, insomnia, and fatigue often result as a direct effect of commonly prescribed medications. Emotional stress causes a person to be tense and often leads to frustration when sleep does not occur. Sleep also causes a person to try too hard to fall asleep, to awaken frequently during the sleep cycle, or to oversleep. Continued stress causes poor sleep habits. Older patients frequently experience losses that lead to emotional stress such as retirement, physical impairment, or the death of a loved one. Older adults and other individuals who experience depressive mood problems experience delays in falling asleep, earlier appearance of REM sleep, frequent or earlier awakening, feelings of sleeping poorly, and daytime sleepiness. Good ventilation is essential for restful sleep. The size, firmness, and position of the bed affect the quality of sleep. If a person usually sleeps with another individual, sleeping alone often causes wakefulness. On the other hand, sleeping with a restless or snoring bed partner disrupts sleep. Following good eating habits is important for proper sleep. Weight loss or gain influences sleep patterns. Weight gain contributes to OSA because of increased size of the soft tissue structures in the upper airway. Successful critical thinking requires a synthesis of knowledge, including information gathered from patients, experience, critical thinking attitudes, and intellectual and professional standards. Clinical judgments require you to anticipate the information necessary, analyze the data, and make decisions regarding patient care. You adapt critical thinking to the changing needs of the patient. Personal experience with a sleep problem and experience with patients prepares you to know effective forms of sleep therapy. You use critical thinking attitudes such as perseverance, confidence, and discipline to complete a comprehensive assessment and develop a plan of care to provide successful management of the sleep problem. Professional standards such as the nursing scope and standards of practice, clinical guidelines for the treatment of primary insomnia and excessive sleepiness, and evidence-based geriatric nursing protocols for best practice provide a valuable guidance to assess and address the needs of patients with sleep disorders. Assess patient sleep patterns by using a nursing history to gather information about factors that usually influence sleep. Sleep is a subjective experience. Only the patient is able to report whether or not it is sufficient and restful. If the patient is satisfied with the quantity and quality of sleep received, you consider it normal and the nursing history is brief. If a patient admits to or suspects a sleep problem, you need a detailed history and assessment. If a patient has an obvious sleep problem, considering asking if his or her sleep partner can be approached for further assessment data. A poor night's sleep for a patient often starts a vicious cycle of anticipatory anxiety. Usually patients are the best resource for describing sleep problems and how they represent a change from their usual sleep and waking patterns. In addition, bed partners are able to provide information about patient sleep patterns that helps reveal the nature of certain sleep disorders. When caring for children, seek information about sleep patterns from parents or guardians because they are usually a reliable source of information. Two effective subjective measures of sleep are the Epworth Sleepiness Scale and the Pittsburgh Sleep Quality Index. Another brief subjective method to assess sleep is a numeric scale with a 0 to 10 sleep rating. When suspecting a sleep problem, assess the quality and characteristics of sleep in greater depth by asking the patient to describe the problem. This includes recent changes in sleep pattern, sleep symptoms experienced during waking hours, use of sleep and other prescribed or over-the-counter medications, diet and intake of substances such as caffeine or alcohol that influence sleep, and recent life events that have affected the patient's mental and emotional status. If a patient's sleep is adequate, assess his or her usual bedtime, normal bedtime ritual, preferred environment for sleeping, and usual preferred rising time. When a patient has a sleep problem, conduct a complete sleep history. Diagnosing sleep problems depends on identifying factors that impair sleep. A general description of the problem, followed by more focused questions, usually reveals specific characteristics that are useful in planning therapies. To begin, you need to understand the nature of the sleep problem, its signs and symptoms, its onset and duration, its severity, and predisposing factors or causes, and the overall effect on the patient. Proper questioning helps to determine the type of sleep disturbance and the nature of the problem. As an adjunct to the sleep history, have the patient and bed partner keep a sleep-wake log for 1 to 4 weeks. Ask the following questions to determine a sleep pattern. What time do you usually go to bed each night? How much time does it usually take for you to fall asleep? Do you do anything special to help you fall asleep? How many times do you awaken during the night and why? What time do you typically wake up in the morning? On average, how many hours do you sleep each night? Patients with sleep problems frequently show patterns drastically different from their usual one, or sometimes the change is relatively minor. Determine whether the patient has any pre-existing health problems that interfere with sleep. A history of psychiatric problems also makes a difference. If the patient has recently had surgery, expect him or her to experience some sleep disturbance. Patients usually awaken frequently during the first night after surgery and receive little deep or REM sleep. Depending on the type of surgery, it takes several days or months for a normal sleep cycle to return. In your assessment, learn if the patient is experiencing any changes in lifestyle that disrupt sleep. A person's occupation often offers a clue to the nature of the sleep problem. A patient's emotions and mental status affect the ability to sleep. When a sleep disturbance is related to an emotional problem, the key is to treat the primary problem. Its resolution often improves sleep. Ask the patient what they do to prepare for sleep. Pay special attention to a child's bedtime rituals. Some young children need a special blanket or stuffed animal when going to sleep. Observe for behaviors such as irritability, disorientation similar to a drunken state, frequent yawning, and slurred speech. If sleep deprivation has lasted a long time, psychotic behaviors such as delusions and paranoia sometimes develop. Review your assessment data looking for clusters of data that include defining characteristics for a sleep pattern disturbance or other health problem. If you identify a sleep problem, specify the condition such as insomnia or sleep deprivation. By specifying the sleep disturbance diagnosis, you are able to design more effective interventions. Assessment also identifies the related factor or probable cause of a sleep disturbance, such as noisy environment or a high intake of caffeinated beverages in the evening. Professional standards are especially important to consider in developing a care plan. As you plan care for a patient with sleep disturbances, creation of a concept map is another method for developing a holistic patient-centered care. When developing goals and outcomes, it is important for a nurse and patient to collaborate. Patients are a helpful resource in determining which interventions hold priority. When patients have chronic sleep problems, the initial referral for a patient is often to a comprehensive sleep center for assessment of the problem. The nature of the sleep disturbance then determines whether referrals to additional healthcare providers are necessary. Nursing interventions designed to improve the quality of a person's sleep and rest are largely focused on health promotion. Patients need adequate sleep and rest to maintain active and productive lifestyles. During times of illness, rest and sleep promotion are important for recovery. In community health and home health settings, help patients develop behaviors conducive to rest and relaxation. Patients benefit most from instructions based on information about their homes and lifestyles, such as which type of activities promote sleep in a night shift worker, or how to make the home environment more conducive to sleep. They will likely apply information that is useful and valued. All patients require a sleeping environment with a comfortable room temperature and proper ventilation, minimum sources of noise, a comfortable bed, and proper lighting. Eliminate distracting noise so the bedroom is as quiet as possible. In the home, the television, telephone, or the intermittent chiming of a clock often disrupts a patient's sleep. Patients vary in regard to the amount of light that they prefer at night. Bedtime routines relax patients in preparation for sleep. It is always important for persons to go to sleep when they feel fatigued or sleepy. A bedtime routine, meaning the same hour for bedtime, a snack, or a quiet activity, when this is used consistently, helps young children avoid delaying sleep. Adults need to avoid excessive mental stimulation just before bedtime. For any patient prone to confusion or falls, safety is critical. Nightlight, bed set lower to the floor, and remove clutter. Sleepwalkers are unaware of their surroundings and are slow to react, increasing the risk of falls. Do not startle sleepwalkers, but instead gently awaken them and lead them back to bed. Infants' beds need to be safe. To reduce the chance of suffocation, do not place pillows, stuffed toys, or the ends of loose blankets in cribs. Loose-fitting plastic mattress covers are dangerous because infants pull them over their faces and suffocate. Parents need to place an infant on his or her back to prevent suffocation. People fall asleep only after feeling comfortable and relaxed. In the home, it helps to encourage patients to stay physically active during the day so they are more likely to sleep at night. Increasing daytime activity lessens problems with falling asleep. The inability to sleep because of emotional stress also makes a person feel irritable and tense. When patients are emotionally upset, encourage them to try not to force sleep. Otherwise, insomnia frequently develops, and soon bedtime is associated with the inability to relax. Preschoolers have bedtime fears, such as the fear of the dark or strange noises. They awaken during the night or have nightmares. Cultural tradition causes families to approach sleep practices differently. Some people enjoy bedtime snacks, where others cannot sleep after eating. A dairy product such as warm milk or cocoa that contains L-tryptophan is often helpful in promoting sleep. A full meal before bedtime often causes gastrointestinal upset and interferes with the ability to fall asleep. Warn patients against drinking or eating foods with caffeine before bedtime. Melatonin is a neurohormone produced in the brain that helps control circadian rhythms and promote sleep. It is a popular nutritional supplement that is found to be helpful in improving sleep efficiency and decreasing nighttime awakenings. The recommended dose is 0.3 to 1 milligrams taken 2 hours before bedtime. Several other herbal products assist in sleep. Valerian is effective in mild insomnia and RLS. It affects the release of neurotransmitters and produces very mild sedation. Kava helps promote sleep in patients with anxiety. It should be used cautiously because of its potential toxic effects on the liver. Chamomile, an herbal tea, has a mild sedative effect that may be beneficial in promoting sleep. The use of non-prescription sleeping medications is not advisable. Patients need to learn the risk of such drugs. Over the long term, these drugs lead to further sleep disruption even when they initially seem effective. In a hospital, the nurse controls the environment in several ways. When planning interventions to promote sleep, consider the usual characteristics of the patient's home environment and normal lifestyle. Patients in acute care settings have their normal rest and sleep routine disrupted, which generally leads to sleep problems. In this setting, nursing interventions focus on controlling factors in the environment that disrupt sleep, relieving physiological or psychological disruptions to sleep, and providing for an uninterrupted sleep and rest periods for the patient. In a hospital or extended care setting, it is difficult to provide patients with the time needed to rest and sleep. The most effective treatment for sleep disturbances is elimination or correction of factors that disrupt the sleep pattern. When the patient's condition demands more frequent monitoring, plan activities to allow extended rest periods. Patients with obstructive sleep apnea, or OSA, are at risk for complications while in the hospital. Surgery and anesthesia disrupt normal sleep patterns. After surgeries, patients reach deep levels of REM sleep. This deep sleep causes muscle relaxation that leads to obstructive sleep apnea. Patients with OSA who are given opioid analgesics after surgery have an increased risk of developing airway obstruction because the medications suppress the normal arousal mechanisms. Recommend lifestyle changes to patients with OSA that include sleep hygiene, alcohol moderation, smoking cessation, and weight loss program. One of the most effective therapies is use of a nasal continuous positive airway pressure or CPAP device at night, which requires a patient to wear a mask over the nose. The mask delivers room air at high pressure. Patients who are hospitalized for extensive diagnostic testing often have difficulty resting or sleeping because of uncertainty about the state of their health. Giving patients control over their health care minimizes uncertainty and anxiety. Providing for personal hygiene improves a patient's sense of comfort. As a nurse, you will learn to control symptoms of physical illness that disrupt sleep. The liberal use of drugs to manage insomnia is quite common in American culture. Medications that induce sleep are called hypnotics. Sedatives are medications that produce a calming or soothing effect. Benzodiazepines and benzodiazepine-like drugs are common classifications of drugs used to treat sleep problems. Regular use of any sleep medication often leads to tolerance and withdrawal. With regard to problems with sleep, the patient is a source for evaluating outcomes. Each patient has a unique need for sleep and rest. The patient is the only one who knows if sleep problems are improved and which interventions or therapies are most successful in promoting sleep. If a nurse has successfully developed a good relationship with a patient and a therapeutic plan of care, subtle behaviors often indicate the level of the patient's satisfaction. Note the absence of signs of sleep problems such as lethargy or frequent yawning or position changes in the patient. You are effective in promoting rest and sleep if the patient's goals and expectations are met.